Hello, this is Dr. Burns from Burns Integrative Wellness Center. We are live right now talking about anti-aging, microneedling. This is not a new topic. Apparently, the anti-aging, not wanting to get old, has been around forever. We are studying as scientists, like the animal life forms, what happened in the past. It's like in the past, a lot of people thought if I bathe in like milk or goat's milk or something like that, it'll reverse the aging process. We now have where we're looking at this very unique jellyfish. I think it's called a forever jellyfish, and seeing how it keeps itself young. It's like it gets old and then it makes itself young again, and then it gets old and makes itself young again. A lot of my patients say that aging is for the strong, it's not for the weak. So they said the golden years aren't exactly golden, but a lot of people still want to have that youthful glow because we remember when we're in our 20s, we had all that nice collagen and elastin and everything was nice in there, and then all of a sudden we start aging, our hormones go down, the wrinkles start coming in, because for at least women, the wrinkles start coming in because our estrogen levels are going down. And also from all sorts of like sun exposure, stuff like that, it really does a lot on the skin. I mean, like a lot of damage happens as we go through the year. So of course we always preach sunscreen, sunscreen, sunscreen. Whether you're doing natural sunscreens, vitamin D, regular sunscreens over the counter. So it just really depends, but that is definitely going to help with making sure that you don't get the wrinkles later on. Like back, I guess, in the 50s and 60s, people were using like mineral oil and stuff like that and being out in the sun, and we got a whole bunch of people that are really wrinkled and stuff like that, and they're just like, okay, how do I take the wrinkles out? Well, there's a lot of advances that we've made to be able to help out with this. Besides Botox, there's freezing the muscles. That only works for some time. Yeah, it's like you folded a piece of paper so many times that you're trying to straighten it out. So we can freeze the muscles, but there's still the skin layer that we need to work on besides the muscle layer. And that's where a lot of machines come in, like RF, which is refractory CO2 machines that do a type of chemical peel, except it's really deep to kind of help get rid of those. Microneedling is definitely one, and also microdermabrasion. There's some other ones that have come out too, but all of them have, of course, a different price break to it, and we're going to talk about some of those. So right now, the cheapest way is with microdermabrasion. You go in like once a week or twice a week just for the exfoliation process, and then even with that, that can help reduce a lot of the wrinkles. Everyone basically uses it. Estheticians use like diamond tip for the microderms, and in sloughing off the skin, what that does is it removes all the dead skin cells that are in those wrinkles, which can make those wrinkles look deeper. In Arizona, also hydration is huge. That's free. It's like you don't have to go to a doctor to rehydrate. But even like seeing an esthetician just for microderm, that can even help like get rid of a lot of the fine lines and wrinkles on the face, décolleté area, neck, back of the hands. And it helps to overturn the collagen, but it doesn't get as deep. It's just kind of something superficial. So then what's the next step up from there? Next step up from there seems to be Botox. There's Dysport, and now there's one called Xeomin. Xeomin is now just brand new, added out in the last year or two. It's a little cheaper than even the Dysport and the Botox. They said it works about the same. I've done all three on patients, and someone can tell a difference, but some of them also, here again, it depends on metabolism and stuff on which product works best if you're going to be doing that. But you can combine microderm with Botox or Dysport or the Xeomin. You can also combine with the next step up is microneedling. Microneedling, there's two different types. There's one that's over the counter. It's very superficial. What it does is that it creates little micro indentations or holes in the skin in order to force the skin to heal itself. A lot of times we can pair up a microderm with that, but you can't really do that pairing that up at home. I see on like Walmart, Amazon, oh gosh, Google, like these companies that sell just the superficial microneedling. Yeah, you can do that at home, but here again, how safe is it? I mean, it's because you got cross-contamination going on like every time that you're trying to use the brush. I mean, are you cleaning it off enough? Are you sanitizing it enough? I mean, the doggone needles have to be heated up in order for there not to be cross-contamination. Because what happens if you're sick or you had acne one time and you don't clean it off well enough? Say, oh, if I just put in alcohol, it's going to be fine. That bacteria still may be on there, and then you're going to go through with that superficial brush, and then all of a sudden you're just like, well, wait a minute, how come I have this acne again? Well, you just reintroduce the bacteria back in. So the safest way to do it is microneedling, which is go to see your doctor, go to a med spa or someone who has the safe equipment for that to get done. So one, we're not reintroducing any sort of bacteria back into the skin. Two, the needles are sanitary for each individual person. We are not allowed, and it is not allowed for us to be able to take one person who's been microneedled, have those same needles and stick it on someone else. That is so not sanitary. That is, so if you hear of someone doing that, that is not sanitary. It's not right. So don't do that. What we do is we use this little device here, which is called the microneedler. We usually have tips on here. This one doesn't have any blood, it has a block in here. So then that way, if there is like a little bit of blood that comes in, it gets blocked. So that way it doesn't go in. Usually we have a little tip on here with the little micro needles on it. Now the difference between this one and say like your normal one is that I can adjust the depth. So I can go more shallow on the forehead than like on the cheek line or like around the neck area or the décolleté. Even like on the hands, I would probably go a little more superficial than I probably would say like the décolleté area or around the face. So the nice thing is with this is that we do 2 passes. First we go a little shallow. Then after that we go a little deeper, so we are able to dial down and make sure that we can get to those wrinkles. Now the nice thing about this is that this can also help with acne scars, and it can help reduce a lot of the deeper lines as well. Now I've seen everyone with the Kardashians are just like, they have the pictures where they get their microneedling done and they're like all bloody. That's not what we're looking for. What we're looking for is for your face to be nice and pink, not really any blood coming out. The only time that we may do something like that is if the scars are really deep, but we also make sure that you're cleaned up and out before you go, so in that way you don't look like you've been to a Halloween party like for the rest of the year. We do make sure that if you have any sort of family events beforehand, that maybe we do it afterwards, or at least give us a couple of weeks, because you will be a little red. It does take about 2 or 3 days maybe for that redness to go down, just depending on what exactly it is that you want us to be working on. And I know that prices vary per place as far as the cost of microneedling. It can go anywhere from like $150 per session to like $600-700 per session. It could be that other stuff may be added in with that. My office, we usually charge somewhere between like $300 to $400, just depending on what's going on and how we really need to work on that. Other things that can be added into this are like platelets. So we can draw your blood, spin it down, we collect the platelets, and then we can put that on your face superficially, and we can also inject it into the face to enhance the microneedling. We can do Botox with the microneedling. We can do microderm, Botox, PRP, and the microneedling. So a lot of stuff can be added in. And then, of course, there's stem cells. Stem cells can also be added in. We do the microneedling, and then we put the stem cells on the face to help accelerate the rejuvenation process. It takes more than one treatment for this, for anybody. Like for my face, with the lines that I have, I'm probably looking at like 3 or 4 treatments just for my 11s area, and just for my nasolabials right in here, just for that collagen to start producing it. So that's why we space them out about every 3 to 4 months is when we end up doing that. The other thing that we do as well is it may take, besides the 3, and a lot of people sell them in packages of 3, it may take 6 to 8, depending on how deep those wrinkles are and what exactly you're looking for. Everyone sees themselves on a daily basis, so when they come back in, they're just like, I haven't seen anything work. It takes time. For anyone who has any scarring, you have to really come back in every 2 weeks. Just because that skin is overturning, we're really trying to break stuff up. So you are going to be a little bit more bruised. If you have a little bit more redness, especially like if you have like really deep facial acne scarring, we're going to have to get in there and really work on that. For the deeper lines, I work on it the same as I would with the scarring. We just kind of get in there a little deeper, but I don't go as aggressive as I would with scarring. No one would with something like that. So we can treat like surgical scars with this stuff. We can treat, like accidental cuts and all that stuff if the scars have been left behind, in order to get in there and really be able to help tear up that tissue, so then that way new tissue can grow. It's I love having this. Everyone's looking for something new. One of my patients who is really scared of needles, and Botox doesn't work. I have tried every form of Botox and it only lasts 2 weeks on them. There's something about their metabolism to where the body doesn't want to hold on to it. I did the microneedling on them, and this person's like deathly afraid of needles, and she was fine. And I loved it. And she's just like, do it, get me red, just do it. I'm like, okay, fantastic. So we ended up doing a couple of sessions on her. The face, the wrinkles are looking really good. Here again, it's a process. It takes time for that new collagen and elastin to come about. And a lot of people I know want instantaneous results. So that's why we also do the Botox in conjunction with the microneedling. So that way people can get some of the instantaneous results with not having to use those muscles, but then we're also working on the skin at the same time. So if you're wanting to look wrinkle free before the holidays and with pictures coming up, Thanksgiving's coming up in 2 weeks, this is not the treatment for you. We can do Botox, but not the microneedling. Microneedling takes time. So if you want to look good for summer with, if you're doing family trips, then this would probably be a good time to come in and get that done. So then that way we have the time that we can spend to make sure that you get the results that you're looking for during that time, or even before next holiday. I know it's like everyone's going weight loss is, coming up in January. Great. In December, we'll talk about that. Well, we can talk about genetic testing for weight loss and all this stuff. But for here and now, if you're looking for some quick tips on what to do to help revitalize your skin, I would say get an over-the-counter hyaluronic acid serum. Use that first before you put your foundation down. So what you want to do is you want to pile it on with your thinnest stuff first, out to your thickest stuff, which is going to be like your foundation. So your thinner stuff is going to be like your toner, your hyaluronic acid, gels and stuff like that. Then after that, it's moisturizer and your sunscreens. And after that's your foundation, and then the rest of the makeup goes on. So that's one way you could do it. Microderms can be kind of quick. We can get in there. We can slough off some of the dead skin, or if you have some dead skin that's piling up, we can help get rid of that in order to have those wrinkles seem less deep than what they is. And then of course, always hydration is also key as well. And staying out of the sun, or wearing a hat, or sunscreen, as we keep preaching, whether it's natural sunscreen, vitamin D. There's a lot of people who use the prickly pear cactus or aloe, to try and put on there after they've been in the sun to cover their face, so then that way it doesn't have damage at the end of the day. Now, there's a lot of ways to be able to help with that. The hyaluronic acid gels or serums attract water to the area in order to plump up the skin. For those who have estrogen deficiency, a lot of times we can have estrogen compounded into a cream you can put on your face that'll also plump it up as well. You know, like it's a short-term thing, but if people want to get through the holidays, that's one way. But here again, it also takes time for that, for those estrogen creams to take effect as well. So if you have any questions, you can give us a call. You can email us. We're more than happy to work with you on these things. And we have a fabulous month of November. Be grateful. So I am very grateful for everything that I have, and we want everyone to have a fantastic Thanksgiving. In December, we're going to be talking about the differences between diets, and especially like everyone going to genetic nowadays with the genetic testing. How long does that take? How beneficial is it for weight loss or for your nutrition needs and stuff like that? So again, everyone have a fantastic day, and we'll talk to you later.